pain management. Let's talk about pain management strategies. Our goal for you as healthcare providers is to keep your pain to a manageable level that allows you to participate with therapy and do daily activities. We use a pain scale of 0 through 10. 0 meaning no pain, and 10 being the worst pain ever. Providing a number for your pain helps your nurses, surgeon, and therapists evaluate how effective your current pain medicine regimen is. By evaluating your pain score before and after medication administration, we can assess if adjustments need to be made or suggest alternative methods of pain control to help keep your pain manageable. You will have some scheduled non-narcotic medications to help reduce your need for narcotics. Your narcotic pain medications will be ordered on a PRN, or as-needed basis. It is crucial for you to communicate your pain score and changes in your pain level with your nursing and therapy staff. We can't effectively help you manage your pain if we aren't aware of it. Call your nurse and let him or her know when you're needing your as-needed pain medication. We try our best to coordinate your pain medication between the nursing and therapy staff. Activity can actually help reduce pain and stiffness after surgery. Cold therapy is another great tool for helping to manage pain and swelling. Your surgeon will likely order some form of cold therapy. A good rule of thumb for cold therapy is 20 minutes on, 20 minutes off. Always have a barrier between the ice and your skin. Elevating your extremity can also help to reduce pain and swelling. Be sure if you had a knee replacement that your knee remains supported in a straight position with no bend while it's elevated. Distraction, deep breathing, and music are all great ways to help reduce your pain. We will keep you busy during your time with us, but there will also be some downtime. Bring books, music, or videos you enjoy for these times. Somewhere between days 2 and 4 are typically when you will have the most pain and swelling, but the more you move, this will lessen each day. Having no pain after surgery is not a realistic goal. Work with your nurse on developing a pain management plan for you.